In 2020, 2.3 million women were diagnosed with breast cancer globally. Early-stage HR-positive and HER2 breast cancer makes up about 70% of all breast cancer patients. This type of breast cancer can recur 10 years post the initial diagnosis, and with recurrence comes an increased risk of the cancer being metastatic. Genomic testing can predict the risk of recurrence and help guide the right treatment to prevent the cancer from coming back. Chemotherapy and endocrine therapy have been the standard of care for high-risk HR+ HER2 breast cancer patients. The lasting effects and toxicity of these breast cancer treatments can be a lifelong burden on women, on families, and on the healthcare system. Gene expression profiling tests were created to help physicians provide certain treatment recommendations based upon the risk of their cancer recurrence. These tests have changed women's lives. Science and technology have come a long way since first-generation GEP tests that look at molecular gene expression of the tumor alone came to the market. Over the past 10 years, data has shown that clinical and pathological features are necessary to ensure the GEP test provides the most accurate risk assessment. The Prosigna assay is a second-generation test built from the PAM50 molecular subtypes, which combines clinical and pathological features like tumor size, proliferation, and nodal status, along with intrinsic subtypes for a complete risk of recurrence score out to 10 years for postmenopausal women with early-stage hormone receptor-positive breast cancer. In an era of personalized medicine, GEP testing is about making the right choice with the right information for the right patients. The Prosigna assay gives answers you can trust. Choosing which therapy is the right path is a complex process. The Prosigna assay reports 3 key pieces of information specific to your patient: the risk group of low, intermediate, or high, the risk of recurrence score, and the intrinsic subtype of luminal A, luminal B, HER2 enriched, or basal-like. The risk of recurrence score provides valuable information based on trusted science and accurate data to help enable the best decision. In addition, the classification by intrinsic subtypes enables a more accurate assessment of tumor gene expression patterns, as errors in assigning them can significantly affect breast cancer treatment and outcomes. Choose the test that gives a decade of confidence to your patients. Choose the test with proven prognostic performance that gives the most information about a woman's cancer and the risk of distant recurrence. Choose the test that can be performed in local labs on the well-established Encounter system with a result in as soon as 3 days. Choose the best care by better informing treatment decisions that will affect the rest of her life. The Prosigna assay provides the confidence to help make the right choices for women to live their best life for as long as they can live it.